Hello viewers. In this video, we will discuss asthma and respiratory related disease and the triggers which causes them. We will also discuss the herbal remedies for overcoming it. And at the end of this video, we will list the life-changing habits that can help to control it. Asthma is a long-term inflammatory disease of the lungs' airways. It is characterized by variable and recurring symptoms, reversible airflow obstruction, and easily triggered bronchospasms. Asthma symptoms include episodes of wheezing, coughing, chest tightness, and shortness of breath. These may occur a few times a day or a few times per week. Depending on the person, asthma symptoms may become worse at night or early in the morning due to exercise or cold air. It is thought to be caused by a combination of genetic and environmental factors. Environmental factors include exposure to air pollution and allergens. Other potential triggers include medications such as aspirin and beta blockers. Asthma that starts before the age of 12 years old is more likely due to genetic influence, while onset after age 12 is more likely due to environmental influence. There are substances called asthmagens in the environment that causes asthma in exposed workers. Some common asthmagens include ammonia, latex, pesticides, solder and welding fumes, metal or wood dusts, spraying of isocyanate paint in vehicle repair, formaldehyde, glutaraldehyde, anhydrides, glues, dyes, metal working fluids, oil mists, and molds. Smoking during pregnancy and after delivery is associated with a greater risk of asthma-like symptoms. However, low air quality from environmental factors such as traffic pollution or high ozone levels has been associated with both asthma development and increased asthma severity. Asthma is associated with exposure to indoor allergens as well. Common indoor allergens include dust mites, cockroaches, animal dander, fragments of fur or feathers, and mold. Exercise can trigger bronchoconstriction, both in people with or without asthma. It occurs in most people with asthma, and up to 20% of people without asthma. Exercise-induced bronchoconstriction is common in professional athletes. The highest rates are among cyclists, up to 45%, swimmers, and cross-country skiers. While it may occur with any weather conditions, it is more common when it is dry and cold. Asthma as a result of or worsened by workplace exposures is a commonly reported occupational disease. Many cases, however, are not reported or recognized as such. It is estimated that 5 to 25% of asthma cases in adults are work-related. A few hundred different agents have been implicated, with the most common being isocyanates, grain and wood dust, colophony, soldering flux, latex, animals, and aldehydes. The employment associated with the highest risk of problems include those who spray paint, bakers, and those who process food, nurses, chemical workers, those who work with animals, welders, hairdressers, and timber workers. Aspirin exacerbated respiratory disease, AERD, also known as aspirin-induced asthma, affects up to 9% of asthmatics. AERD consists of asthma, nasal polyps, sinus disease, and respiratory reactions to aspirin and other non-steroidal anti-inflammatory drugs medications, such as ibuprofen and naproxen. People often also develop loss of smell, and most experience respiratory reactions to alcohol. Alcohol may worsen asthmatic symptoms in up to a third of people. This may be even more common in some ethnic groups, such as the Japanese and those with aspirin-exacerbated respiratory disease. Non-atopic asthma, also known as intrinsic or non-allergic asthma, makes up between 10 and 33% of cases. There is negative skin test to common inhalant allergens. It starts later in life, and women are more commonly affected than men. Usual treatments may not work as well. The World Health Organization recommends decreasing risk factors such as tobacco smoke, air pollution, chemical irritants, including perfume and air fresheners. Early pet exposure may be useful. Results from exposure to pets at other times are inconclusive, and it is only recommended that pets be removed from the home if a person has allergic symptoms. Omega-3 consumption, Mediterranean diet, and antioxidants might help preventing the disease. The Mediterranean diet emphasizes plant-based foods and healthy fats. Olive oil is the main source of fat. Eat mostly veggies, fruits, and whole grains. Due to garlic's anti-inflammatory characteristics, it is thought to be effective against both allergies and asthma-related issues. It's cheap, delicious, and easily accessible. Garlic cloves can be eaten raw, cooked into food, and even taken as dietary supplement. Boil 2 or 3 cloves in a quart cup of milk and drink it at night before going to bed. Dry figs help clear mucus from bronchial tubes and are therefore a valuable food remedy for asthma. Eating 2 to 4 pieces of overnight soaked figs early in the morning help flushing out the phlegm from the respiratory tract and instantly relieve the asthma patients. Ginger is a superfood for its amazing health benefits. Consuming ginger promotes lung health by improving circulation to the lungs and lowering inflammation. The best way to add ginger to your diet is by having ginger tea. Boil a few ginger pieces, steep it well, and have it with honey. To cure congestion and reduce breathlessness during asthmatic attacks, the best remedy is to boil a small onion in a cup of water and add 1 tablespoon of raw honey with a pinch of black pepper and drink it once a day. Turmeric is also considered superfood because of its anti-inflammatory and antioxidant properties. This herb extremely helpful in relieving asthma-related inflammation. The asthma patient should be given a teaspoon of turmeric powder mixed in a glass of milk before going to bed. It can also be taken raw with tape water at any time of the day. Prioritize good sleep and relaxation. Try to keep your weight in a healthy range. Forget junk food. Focus instead on fresh fruits and vegetables and lean meats. Exercise every day and avoid sedentary lifestyle. Take medications as prescribed and refill prescriptions before they run out. Keep windows and doors closed on days when pollen counts are high and air quality is poor. Please like, share, comment the videos and subscribe the channel for future health beneficial videos.